Thank you, Mr. Speaker, and I thank the gentleman for yielding. Mr. Speaker, in New Hampshire and all across this country, people are dying every day. Communities have been devastated by the heroin and opioid epidemic. Last year, we lost nearly 500 people to substance use disorder in my small state of New Hampshire. Helping families, first responders, treatment providers, law enforcement officials, and activists in the Granite State confront this crisis has been one of my top priorities in Congress. Our communities need our help, and there is strong bipartisan commitment here in the House to respond effectively to this crisis. While we have passed important legislation over the last 2 years, including the Comprehensive Addiction and Recovery Act, the most important thing that we can do is to provide the funding to help those on the front lines of this crisis do their jobs. While I and my Democratic colleagues welcome the President's declaration of an opioid public health emergency, the lack of corresponding funding means that this commitment has been little more than empty rhetoric. We need leadership from Congress and the President to save lives across the country by providing real solutions to the opioid epidemic, and I call on my colleagues to act now. During the State of the Union, the President once again expressed his commitment to working to address the opioid and heroin epidemic, but unfortunately his actions have fallen short of his rhetoric. I've come to the floor today so we can defeat the previous question and bring up for consideration my legislation, the Respond Now Act. This critical legislation creates a $25 billion opioid epidemic response fund to provide $5 billion annually over 5 years, targeted to numerous key initiatives involving agencies such as the Substance Abuse and Mental Health Services Administration, the Centers for Disease Control, and the Institutes of Health. This includes $18.5 billion for SAMHSA grants to states, particularly those targeted at expanding medication assistance treatment, which opioid experts agree is among the most critical ways to help those suffering from substance use disorder. My bill also provides funding to increase the number of substance use treatment providers and to expand medical research related to the opioid epidemic. Additionally, it provides $2.5 billion for critical CDC initiatives, such as expanding and strengthening evidence-based prevention and education strategies. And finally, the bill includes funding specifically to support children and families impacted by this opioid epidemic, including $250 million to support the Child Abuse Prevention and Treatment Act, which can help address the risk of adverse childhood experiences, a known driver of this epidemic. We need to break the cycle, and these programs are ideally suited to support substance abuse treatment services to help families stay together and keep children in safe and stable homes. The opioid crisis is a multifaceted challenge, and we're fortunate that so many amazing researchers, first responders, law enforcement officials, community activists, and others are doing amazing work in communities all across our country. But they need the resources to effectively meet these challenges. We must stop playing political games and act immediately to provide emergency funding to help stop this crisis in New Hampshire, in Florida, and all across this country. Mr. Speaker.